House Chair, a country's legislation may help or hinder people with disabilities to overcome barriers to economic, civic, and community life. Widely regarded as one of the most progressive constitutions in the world, Section 9 of the South African Bill of Rights specifically states no one may be discriminated against on the grounds of disability, amongst others. This section also expressly protects the rights of disabled persons by providing that the state must take whatever steps necessary to protect and advance persons or categories of persons disadvantaged by unfair discrimination. These steps are inclusive of the enactment of national legislation, as well as the monitoring of the development of such vulnerable groups. The ANC, however, woefully fails in meeting such needs. Persons with disabilities are still some of the most marginalized groups within South Africa, with poor access to basic services. One such an example is the infamous Life Isidimeni tragedy, and I would like to quote a Human Rights Commission article on how the South African government is failing people with disabilities, and it states, in 2016, at least 118 of Gauteng's most vulnerable mental illness patients died after the Provincial Health Department had terminated its contract with Life Isidimeni and moved the patients to defective NGOs. The arbitration hearings are underway, with shocking testimonies coming to light. The legal consequences of the catastrophe are manifold. Numerous basic human rights, including the paramount right to life, were flouted. In his report, the Health Ombudsman said the Provincial Health Department ignored warnings and moved patients out of Life Isidimeni into ill-equipped and unlicensed NGOs. In fact, he likened the move to that of an auction cattle market where patients were left to die in poor conditions. The supreme tragedy of the Life Isidimeni saga is that it was entirely avoidable. This is proof that the ANC are failing our people with disabilities. People with disabilities, especially those living in low and middle income countries such as South Africa, experience significant challenges in accessing healthcare services and support. At times of disaster and emergencies, people with disabilities are further marginalized and excluded. During the COVID-19 pandemic, many people with disabilities were unable to access healthcare facilities, receive therapeutic interventions or rehabilitation, or gain access to medication. Of those who were able to access facilities, many experienced challenges and at times direct discrimination accessing life-saving treatments such as intensive care unit admissions and ventilator support. Assistance is a daily battle for people with disabilities. The ANC are very good at trying to legislate people into jobs and into equality, but always fail dismally in the process. People with disabilities are no different. The ANC are also good at talking about a problem without actually addressing the issues faced head on and with clear-cut plans of action. This can be seen in another presidential working group that has been established. This time it is one for disabilities. The president himself admits that the government are not meeting the needs of the people. There are a number of articles looking at the African continent and specifically South Africa with regards to persons with disabilities. Although South Africa does not rank in the bottom percentile when it comes to access to transport, healthcare, etc., it still has a lot of improvement that needs to happen. Stats SA found that persons with severe disabilities experience difficulty in accessing education and employment opportunities. They also found that households headed by persons with disabilities were found to have less access to basic services compared to households headed by persons with disabilities. But I conclude, in the last 10 years, people with disabilities have organized themselves into their own organizations in 100 countries. This is good, but what we need to see is that persons without disabilities are stepping up to the plate. We need to see government stepping up. We need more basic services being disability friendly. We don't need more talk without action. I thank you.